I'm Dr. Steven Greenman. I'm a clinical dentist. I've been in practice for 41 years, 33 here in our current location in Westlake Village. Been treating obstructive sleep apnea as a large part of our practice for the past 14 years. Dental treatment for obstructive sleep apnea is the alternative to CPAP. What would you rather have? A big mask that goes on your face and sound like Darth Vader breathing, or have a very discreet, like a retainer that just goes in your mouth and nobody would know that it's even there. You don't have to take it off if you get up in the night to go to the bathroom or something like that. So there's some big advantages to not having to wear a CPAP. And one of the most exciting things about it is that over the past 10 years or so, there's a growing body of evidence that the dental device compares favorably to the CPAP in terms of reducing disease. Okay, high blood pressure, it would be one big one. Also just feeling refreshed in the morning and not having to drive sleepy. Drowsy driving is a thing of the past. Being more clear in terms of your ability to think and all of that because you've had a good night's sleep. So that's really been tremendous, these non-inferiority studies. In fact, several studies now are showing that even for reduction in mortality, in death, the dental device is comparing favorably to CPAP, even for folks that have severe sleep apnea. To put a point on it, severe sleep apnea, untreated severe sleep apnea, your 8-year survival rate is only 80%. It means 20% of the folks that have this malady are dead after 8 years, and after 18 years, 43% of them are dead. So this is a very serious disease, and the unfortunate thing is that more than half the people who get the CPAP just can't wear it, as opposed to getting the dental device, which has a retention and success rate of like 85%. Because of what I've just described. It's just more comfortable, it's more discreet, and it's just easier to handle all the way around. Another plus of that is that it will reduce loud snoring in 90% of the people who get these devices. And I want to repeat that. If you're a loud snorer, that in and of itself is abnormal and it is dangerous. It leads to transient ischemia attacks, which are like mini strokes. And if we can eliminate that loud snoring, which these devices do, so much the better, and your health will improve. And not only that, your household will improve because you're not going to be snoring and keeping others awake.